Hi, my name is Jessica Imbersha. I am a student physical therapist assistant at Concord Career College in Dallas, Texas. And today I'll be talking about the pelvic floor, in particular incontinence. So one thing most people don't quite realize exactly what is incontinence. So most people think of it as a full loss of bladder contents, when in actuality, incontinence can be anything from a small, tiny drop of leakage to the full bladder loss. But I think people don't quite realize is how common it is. And a lot of times we don't realize that because it's kind of hush-hush. For some reason, there's a little bit of shame attached to it. But in reality, there's 1 out of 4 women over the age of 18 who experience incontinence. And then when you get to 65 years of age, it's 1 out of 2. So it's very, very common. And it's not just associated with age either. You have young women who get it, athletes, very strong women, but all the weightlifting and the pressure, the pounding on the pelvic floor, especially if while holding the breath, tighter pelvic floor can cause incontinence. Also, if you have chronic constipation at any age, it can lead to incontinence. Most people do realize that childbirth, a delivery process, can cause a weaker pelvic floor and therefore incontinence. But some people, what they don't realize is just simply growing a child inside you, having that extra weight and the pressure. And of course, with just those activities of coughing, sneezing, that can lead to a weakened pelvic floor. So C-sections as well as vaginal deliveries. And then, of course, menopause. So with menopause, you have great changes with hormones, and a lot of tissue, the muscles included, are kind of estrogen dependent. So it changes, gets a little bit weaker with menopause and with age in general. So another thing people quite don't realize is the fact that there's help out there. So like you might realize, oh, okay, so I do have a little droppage, and okay, that's actually incontinence. But then they might think, oh, what's the big deal, you know? But if it is limiting you from doing certain things, from running, from wanting to jump on the trampoline to play with your kid, like laughing or whatever, then there's help out there for that. And in particular, there's a physical therapy specialization in pelvic floor health or women's health that they can focus on and help relieve that, as well as a multitude of other things, not just incontinence. So the thing with incontinence is there are different types. The most common one is stress incontinence, and that is where, like I mentioned earlier, if you are laughing, sneeze, cough, jump, go to lift something, move, and it causes a little bit of leakage, that's typically stress incontinence. There's also another fairly common one is urgency incontinence, and that's if you get this sudden, strong desire to go to the bathroom, and you can't quite make it. You might experience a little bit of leakage on the way to the bathroom, or again, it might be a full loss. And there are other factors as well, but those are the most common types of incontinence. So once you kind of know what the type of incontinence you have, you can look at like the underlying causes of it. A lot of times it is pelvic floor weakness, but it can also be pelvic floor tightness. So again, finding a good physical therapist who does the internal exams and external exam to actually see what's going on with the muscles, and maybe it's the coordination of the muscles, not just simple weakness. Again, maybe it's more of that it's hypertonic, there's more tone, it's tighter, tense. Maybe there's there's lots of different factors that can cause it. So going to a physical therapist, figuring out what you have, and that will give you a better kind of like plan of care, which will give you better results so that you're doing things that are actually going to help you versus exacerbate it. Like if you have that tighter pelvic floor and you think, like most people think, oh, I'm just going to do a lot of pelvic floor contractions, that can actually make it worse. So it is important to know what you have so that way you can do the correct actions. And I did mention the pelvic floor contractions, and that is a common one when it comes to incontinence, especially, again, if you have the weaker incontinence. So a lot of times the stress incontinence can be caused from the weaker pelvic floor, and then you do your pelvic floor contractions. You want to make sure you know how to do them correctly. A lot of people, when they do a pelvic floor contraction, they are actually pushing down, and it's tense because of the pressure of you pushing down, and they perceive that as I'm tightening, I'm strengthening, but actually you're not. You're weakening down there. So a true pelvic floor contraction is actually a lifting action. And it's not just the front, it's actually going to be the back, so the anal sphincters, the perineum, which is kind of more like, you can think of it like the middle area, and then the urethral sphincters, which are more in the front. And getting all of that included, because the pelvic floor is like a diamond shape, and it's all the muscles, superficial, deep, so it's all included in the pelvic floor contraction. Sometimes you'll even feel like belly button lifts, so it's never down, it's always knowing the difference there. Again, the physical therapist can help to make sure you're doing a correct Kegel or pelvic floor contraction. So then you have different types of pelvic floor contractions. So for example, you have like the quick flicks. So if you have a stress incontinence, a lot of that, the incontinence stems from that sudden burst of activity, which causes this burst of like intra-abdominal pressure that the pelvic floor can't quite like control, can't quite maintain. So doing the quick contractions, so that's like your fast twitch muscle fibers, will help out. It's also important though that it's not just the contractions. When people know about pelvic floor contractions, a lot of times they're thinking, I'm going to do them all day long and I'm just going to go boom, 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 boom. But in actuality, it's like you wouldn't sit there and do like bicep curls all day long. So the pelvic floor muscles are like any other muscle inside the body. So you would just train them like how you would train any other muscle in the body. You wouldn't do it all day long. And you also want to focus on the resting phase as well, because that's a lot of times when your strength builds from. So knowing to relax between each contraction. So it's not this like da, 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 da. It's more of like you relax and you're contracting, relax and contract. So it's a full up and down little tiny contractions. That's going to give you a stronger contraction, and it's going to help to make sure that you're not tightening the area, again, which can lead to other problems, even all the way to chronic pelvic pain. So the other type of pelvic floor contraction is kind of more endurance based. It's like your slow twitch muscle fibers. And that one, you typically want to hold the contraction for maybe up to 10 seconds. Again, a lot of times when you're first starting with these contractions, you might find that you can't do 10 quick contractions. You might find that you can't do a full 10-second hold. So you might only be able to start like at 3 to 5 seconds. You might even find that there's like a dip. So like as you're holding, it's like, oh, and then you gotta re-engage and pick it back up. So as you get better with the contractions, as you get stronger, you're gonna notice there's gonna be less of that dip. It'll be a nice solid contraction. You typically wanna start your contractions lying down, so that way you're not having to contract against gravity, which is a lot harder. So again, your physical therapist will help you to figure out where you need to start, how to progress, making sure you're not moving too quickly or too slowly. It's a whole lot more to it than most people think of when they think of pelvic floor contractions. So another thing with it is, as I mentioned, with the relaxation part. So maybe it's not just like a weak pelvic floor. Maybe it's a hypertonic pelvic floor, so you have more tension there. So it's more about relaxing, down regulating the nervous system, so you're not super tense. And as I said, like the pelvic floor muscles are like any other muscle in the body. It can also get trigger points, and it can be really tense. So you might stretch it. So you might be doing inner thigh stretches. You might be thinking about posture. If you're sitting like tucked under more, you're actually kind of shortening the pelvic floor. In reality, when you have good posture, pelvic floor, the diaphragm will be, not the diaphragm, but the diamond will be a little bit more open, which is what we want. So we don't want to chronically shorten the area. The other thing to think about with a tight pelvic floor is your breathing. So a lot of times people breathe kind of more up in here, and they have neck tension and whatnot as well. But in reality, we want you to breathe more with your primary respiratory muscle, which is your diaphragm, and it's a dome-shaped muscle underneath the heart and lungs. So as you inhale, it flattens, and as you exhale, it comes back up. When it flattens, your abdominal organs have to go somewhere. So they're gonna go down and out. That's why your belly comes out as you inhale. But as it goes down, so now you're thinking, okay, what's happening down there in the pelvic floor? If you have a really tight pelvic floor, it's not gonna come down and kind of accept the weight, the load of the abdominal organs. That can lead to incontinence, because you've got this pressure and it's going to cause leakage. So what we want is a nice kind of pliable, adaptable pelvic floor. So as you inhale, as you focus on breathing, as you inhale, the diaphragm, respiratory diaphragm goes down, and the pelvic floor diaphragm should also go down. So it gets a nice stretch every time you inhale. And then as you exhale, they both come back up. So what's fun about that is if you're working on your pelvic floor contractions, which is lifting, if you do it on the exhalation, it can be a little bit easier, a little more doable. Eventually, because most people do have a hard time doing a pelvic floor contraction during an inhalation. So eventually be able to maintain that contraction even while as you inhale, because you don't want to hold your breath when you're doing any form of exercises, including your pelvic floor exercises. The other thing is, again, just relaxing, because the breathing is going to help you relax as well as help with kind of the movement of the pelvic floor. We want to relax, especially if you have more of that tense pelvic floor. You want to be aware of if you're contracting down there all day long. So you want to soften, feel like more like there's a spreading, and then when it's time to contract, it contracts, and when it's time to relax, it can relax. So it's not stuck in any particular kind of way. So the other thing here is kind of knowing like a little couple like tips and tricks with it. So once you've kind of figured out if you have stress incontinence, they call it squeeze before you sneeze. And what that is if you realize like you're about to sneeze or you're about to start coughing or like you're about to start laughing or something, then you can actually prime the area by doing a pelvic floor contraction. So it's like it's ready to go, and it can help prevent leakage there. Downside is sometimes we don't quite realize we're about to sneeze or cough or something's funny, it just suddenly happens. But you can start to train the area and get it used to kind of knowing what to do, when to do it, how to do it, all that good stuff. Then on the other side, if you have the urgency incontinence, the little kind of tip there, the trick there is once you experience that is to sit down and contract and relax the pelvic floor 3 times. What's really fun about the pelvic floor is, and the bladder, is they're kind of like connected. The trusor, the bladder muscle, is kind of connected with the pelvic floor, not literally, but so when you contract the pelvic floor, a lot of times it keeps the detrusor muscle more relaxed. And then when you go to urinate, you want to relax the pelvic floor muscle so the detrusor muscle will contract and allow you to urinate. So if you sit down, because it's easier to contract the pelvic floor muscles, as I mentioned earlier, instead of standing up, you sit down, contract, and you're telling your bladder, not yet, you hold on. And then you might wait until that urgency passes, and then you can continue on, either doing the activity that you were doing or going to the bathroom. But a lot of it is kind of retraining the bladder, your nervous system, to come back to normalize. So that's all we have for today. Again, knowing to be able to find a good physical therapist who specializes in this. You can go to apta.org, and they have a find the PT within that specialization. Knowing what you have, how to work with that, those little tips and tricks, and just knowing that there's help out there. A lot of times, you don't know that things can be better. So just having that hope. So thanks for listening, and have a great day.